Hey, it's Dr. Miller here. We're in the operating room today, and I'm doing this is called a composite graft. Now, a graft, everyone sort of hears graft and flap. The difference between a graft and a flap is that a flap is taking a piece of tissue that is still sort of attached to the body somehow and just sort of transposing it. So sort of making an incision and then you move it over. And a graft, on the other hand, is taking something completely out of the body, modifying it, and then putting it back in somewhere else. When it comes to rhinoplasty, we typically talk about a lot of cartilage grafts. So they're grafts that are taken from the septum, or the partition between the right and the left nostril, the rib, or in this case, the ear. And that's used typically for one of two things. It's either used for primarily structure, so you want a thin, strong piece of cartilage, or the other reason why you take cartilage is for camouflage or for filling, or just to add volume where you don't have it. This is sort of an interesting graft. It's called a composite graft, and the composite part comes in because often grafts consist of just one type of tissue, either cartilage or skin or even bone. This graft that I'm working on right now is a composite graft, which means that it contains both, or two types of tissue. And in this case, it contains both skin as well as cartilage. Now, I'm going to show this. If you're a little squeamish, you don't have to watch, and then I'll tell you when to come back in again. But if you want to come in a little bit. So this is cartilage right there, okay? But then if I flip it over, you'll see that there's actually a small piece of skin here. And that skin is attached to the cartilage. And that's a piece of skin that I'm going to be using on the inside of the nose to bridge a gap that exists right now. Because on the outside of the nose, I actually want to push down something. And when I push it down, it forms a gap in the middle. The cartilage here is meant to plug that gap to make sure that pushing down of the tissue stays pushed down, so the cartilage is rigid. But in so doing, I now have a gap of skin, if you will. And that's where the composite part comes in, where the skin component of the composite is. This is now replacing the non-existing skin in forming that hole or gap in the inside of the nose. So that's what a composite is. And for those of you a little too squeamish, you can now look back. And for the sort of defect that I created, I create a very, very detailed kind of, I create a very detailed outline of the actual defect. That gets transposed onto the ear, then I carve everything out, and that's what I'm working on right now. And that's going to go in. So that's a composite graft.